4,384 eye camps, 94,996 cataract operations, 2,400,000 patients operated on. This is the life-changing story of East and Central Africa's largest eye hospital. Tucked in the serene green neighborhood of Loresho in Nairobi, Kenya, is the Lions Sightfirst Eye Hospital.
The Lions Hospital was established 20 years back. We have touched the lives of nearly over 2 million people during this period, and our job is to make sure nobody goes blind.
Nobody deserves to lose their eyesight. Yet, every day, hundreds of patients throng this world-class facility with various eye-related problems.
The Optical Center was established in 2007. We, that time, started with 3 testing rooms. We've now grown to 7 testing rooms. We have 9 optometrists and 6 dispensers. We also have our own in-house workshop where we make all our glasses. We have a low vision department and we specialize in contact lenses.
We realize that if we do not make it deliberate to give people the gift of sight, then probably no one else will. That is why we do not think twice about offering unmatched eye care services for all our clients.
Our services, our costs are essentially far much cheaper. We're definitely 30 to 40% cheaper than any other medical facility that you can find offering similar or even lesser services.
We not only cater for adult patients, but children as well. Our dedicated pediatric unit is a child-friendly environment where children are provided with the space to enjoy playing as they await to be served. The need to make the patient's journey pleasant influenced our resolution to establish a fully functional in-house workshop where we provide our clients with high-quality spectacles at the most affordable rates.
We order the blank lenses and then we cut them according to the size needed in our workshop. We fix them into the spectacles immediately and then give them out to the patients on the day.
We have the only eye bank in East and Central Africa.
We started what you call the cornea program, the only one of its type in Central and East Africa. We started this program by importing corneas from overseas like Sri Lanka, Germany, UK, America.
We conduct cornea grafts, a surgical process that involves using another person's cornea to give sight to a blind person.
The eye bank is where we retrieve corneas for those people who have donated, and people donate their corneas when they pass on.
We value the pride that good vision brings to human beings. We have invested in the best medical equipment in all our departments. Our checkup units provide top-of-the-range testing equipment manned by some of the best medical personnel in the region. We are alive to the fact that world-class care requires world-class equipment and staff, so as to ensure that the journey to restore your sight is efficient and results-oriented.
Patients who have diabetes are potential candidates for having retinal problems. There's something called diabetic retinopathy. That is what is the major chunk of our work that we do.
Our Diabetes Care Center is our first stop to eradicating preventable blindness. We offer testing, nutritional education and advice, and general care for diabetics. The Lions Sightfirst Eye Hospital is a charitable organization whose impact in fighting needless blindness stretches to every corner of the country. Every week, our community outreach team traverses different parts of the country to offer a helping hand to the most needy members of the society.
Our ethos is actually to ensure that we are giving the gift of sight, and we're making sure that people in far remote areas who might not otherwise be able to come all the way to Nairobi because of their poor economic conditions, we reach out to them and we do our best to try to help them.
The Lions Sightfirst Eye Hospital runs a vibrant eye screening program for school-going children under the banner of Sight for Kids. Our mission? To ensure that we reduce needless blindness among school-going children. Our local and international partners have made our outreach programs robust. We can only do more.
The vision for the Optical Center is to now establish a state-of-the-art low vision center. Low vision is whereby we cannot correct the person's vision any further with glasses or surgery. So therefore we help them with visual aids such as magnifiers, telescopes, CCTVs, walking canes. But most importantly, we need to give them a lot of rehabilitation. So the center aims to provide these services at very low cost, affordable to anyone in this country.
Even as we continue to work hard every day towards a blindless population, we are constantly reminded of the need to live a healthy life.
A thorough comprehensive annual eye checkup is a must after 40. Just make sure that you check your eye pressures, you check for your retina part, you check for all the aspects of the eye when you go to a specialist.
It is also noteworthy that every one of us bears a responsibility towards having a population that sees. Donating of the cornea after death is a practice that we ought to embrace if we are to fight needless blindness.
I would urge our fellow Kenyans to embrace the organ donation. Most of our patients on the waiting list are of African descent, and unfortunately, most of them are below 30.
My appeal to all the communities of this world, and in particular to the 1-inch is one and the region, that please after death try and donate your corneas, because somebody out there is going to benefit, see through those eyes for the next 50 to 70 years. And if you do not donate, it's going to be either ashes, those eyes, or it's going to back to the earth. You might as well give to somebody, improve the life of that particular individual who actually will be very grateful to you for the next 70 years.
Giving dignity through restoring eyesight is our greatest joy. As the Lions Sightfirst Eye Hospital fraternity, we take full responsibility in serving those who rely on us for sight. We can never abdicate our duty to reduce the economic burden of blindness to families and the nation at large. For as long as we can, we commit to offer world-class eye care and give dignity to the needy. We will continue to do what we do best until we win the war against needless blindness.